I'm Juliet Mirasol, Mrs. Universe Continental Asia, and I'm here at CSA Medical Aesthetics for my skin rejuvenation for the preparation of my competition in South Korea. I learned CSA through my friend Patricia. She's also a model here, and through Facebook and Instagram kasi ang ganda ng review sa kanya ng CSA kay Dr Contessa. I'm here to prepare my skin for my upcoming competition para I look fresher and younger, para mas ready, di ba? So stay tuned and we'll see kung anong gagawin ni Doc na procedure for my skin.
Good day everyone, welcome to the CSA Medical Aesthetics. I'm Dr. Contessa, your certified aesthetic physician. In today's episode, we have a new guest. Let's welcome Ma'am Juliet. Welcome, Juliet.
Hello, Doc.
Yeah, right. So Juliet looks so young, but if I ask her age, how
48,
young?
I'm 48
Yeah,
now.
I don't even believe that you're already in your late 40s, but you look a lot younger.
Thank you.
Okay. Well, actually, thank you, Juliet. I've known Juliet from social media,
Yes,
okay? So,
Instagram.
Instagram, and she just messaged me that she has these concerns. Of course, at this stage, we wanted to do some rejuvenation procedures, and we want non-surgical, right? Because
Yes.
you have an event.
Yes, I'll
Like-
be joining Mrs. Universe
Oh.
in June at South Korea.
See, wow, South Korea, and we're so proud that you're representing the Philippines. Thank you so much. Okay, so we wanted a treatment that will somehow give you a refreshed look, and of course, no downtime. So, if we will be doing a non-surgical procedure that has needle injections, we have to make sure that we don't induce any hematoma there or any edema there. So we wanted a treatment that will refresh the look of Juliet and make her prepared for that big event.
I'm so
Like-
excited, Doc.
Yeah, it's really we're privileged, we're honored that we have you with us today. And we have some of our televiewers that are asking me, like for example, Doc, I'm already nearing 50s. What kind of treatment could I do that has no downtime or just minimal downtime only? And of course, very safe. And Juliet here already had experience in the past, some injections of like Botox and fillers, and even threads, right?
Few months
Yeah.
ago, yes.
Yeah, and even threads. So at least somehow you have an idea already of these non-surgical procedures for rejuvenation. And looking at Juliet right now, actually, if you're gonna be assessing her face, the upper third of the face, of course, we notice some fine lines there, right?
Yes,
Some
signs of aging.
signs of aging. Like if you move the eyebrow and then you frown your like this part here, then you can see some of those wrinkles. Okay.
Yes.
Which is I have to, okay? I'm already 50, so we develop these kinds of signs of aging. And then looking at the temple, there's volume loss. And then when we go to the mid face, okay, the under eye region, and then the cheek area, you can see some also deep grooves there, and the nasolabial, right? The nasolabial fold. And when you go to the lower third of the face, some of these lines also on the sides of or corners of the mouth and the marionette lines. So we wanted to do something to improve this and give you that refreshed look in a non-surgical way. Okay? And we want to improve the skin texture, make it clear, no pigments, no dark spots, and just you. Okay, and
So I'm excited.
exactly. So what kind of treatment, what procedure we will be doing for Juliet, we'll show you when CSA Medical Aesthetics return. And we're back. So we'll be doing a rejuvenation treatment for Juliet. So it's kind of like a full face rejuvenation with our non-surgical method. So I'll start with my filler injections, okay? I've mentioned a while ago that she has a volume loss on the temple region. We wanted to improve the temple area for us to correct also any droopy eyelids or like droopiness on the mid-face section. So if you restore the volume for the temple region, you're able to also help the lower part of the face in the lifting effect also. Okay, so for this part, so I need Juliet to turn to the right side, I mean to the left side. Okay, so for the anatomical area where you want to place your filler, you have to make your surface markings there. You have to palpate for your temporal fusion line, the lateral orbital rim, and the zygomatic arch, and your posterior part will be your hairline here. So within the temple, we have subsections here. Actually, I divide it into the upper and the lower. What I fill in is the upper part, and then the upper part, once it's filled in, then you can have your hyaluronic also go down to the lower part of the temple. The reason why I place it in the upper part, because when you do an injection on the deepest layer, you have a safe region here whereby you are avoiding some of the blood vessels in the temple area. So this is a safe region also. You're okay, Juliet? Okay. So for injectors, it's really significant that they know anatomy and they know which anatomical plane and what to avoid. Like here, we want to avoid the superficial temporal artery. We want to avoid the middle temporal artery, plus also some of the deep temporal arteries, anterior and posterior. So my safe injection point, if I use a needle, is this 1 cm lateral to the temporal fusion line and this 1 cm lateral or superior to your lateral orbital rim. So many terms there, Juliet. I'm so sorry. Okay, so now I know my injection point, then I can have a hyaluronic filler here and a needle method. And then I'll just gonna inject the needle towards that part there. So I'll be gentle, Juliet, sorry ha. Okay, I just need to reach that deepest part, which is the so-called temple bone. So since Juliet already had, right? You already had some injections of filler here. So you're not new to this kind of procedure. So once you feel for that periosteal layer or the bony layer, okay, so you're in the right anatomical plane, and then you can already gradually push your product there. So I'll push a little bit. So it's normal, Juliet, that you hear something, like there's something flowing inside. Okay, there you go. So I'll just be very gradual. So we want to correct the temple volume, okay? And we want to push it little by little, gradually. So just slowly. Because whenever I do my temple filler injection, as much as possible, we want to be safe and we want to push it little by little. So actually, when you inject it here, you're near the tail of the eyebrow. And when you feel it in, you're like correcting also droopy eyebrow or droopy eyelids, which is the concern of Juliet also. Right, Juliet?
Yes.
So you're noticing that your upper eyelid is already droopy or saggy. So aside from that, Juliet, do you have other concerns in this part of the face, aside from wrinkles? Okay, we develop wrinkles over time, volume loss, and then even the skin texture, right? You notice there's like lack of there you go, the lack of hydration. As we age, actually we lose hyaluronic, and hyaluronic is attracting water, or it's like a molecule that holds water. So hindi lang collagen or elastin nawawala, pati hyaluronic. So you will replace your hyaluronic. Okay, some terms there. I'm just pushing slowly just to make sure that we are in a safe anatomical plane. Sometimes the filler in this section of our face, if we do like an assessment or like we want to check if you still have the filler. Like for example, they do scanning or even an MRI, they can still see some of the fillers that were injected. So I already noticed like a volumization of the temple here. It gives an instant result. So we'll be proceeding to the left side of the face. Is there a feeling of like fullness or pressure or heaviness?
Yes, I can hear it.
Yeah. whenever we push the filler in this part, since it's in the temple, actually it's near the auditory area, this one, the ear area. So some of my patients are telling me, Doc, I can hear the flow of the filler, which is normal, which is expected. So again, measurement, 1 cm lateral to this temple fusion line, and then 1 cm superior to your lateral orbital rim. And it's like within that tail of the brow here. So I'll just direct my needle here, okay, onto the bone. Okay, I'm already on the bone. Although it's not really necessary that you do aspiration, but in my practice, I'm kind of used to this this habit of aspirating just to make sure. So if there's no like backflow there, then I can push my material. And it's good to do a skin traction there to lift your skin in the upper eyelid region and push your material slowly and gradually just to make sure you are doing the correct technique. So whenever I do my filler, low pressure, slow push, and also in the right anatomical plane. Low and slow. And they say less is more. Right, Juliet? Yes, not too much. Okay, just the right amount. Don't overcorrect. In Filipino, there's a saying, di baling kulang, wag lang sobra. Right?
Should look natural.
Yes, the aesthetic practice right now wants to achieve a very natural result. There's something done on your face, but people cannot really pinpoint what was the change. And I'm just pushing the filler slowly and gently, low and slow. Right. You can still hear the flow or the gushing of the filler. Take note, hyaluronic is in a gel form, okay? So anything that is a gel, it has particles with it. So the particles are your hyaluronic substances. And hyaluronic is, in science, we call it amino polysaccharide, or like a protein polysaccharide, or like a combination of your protein amino acids with your carbohydrates. It's like a food, huh? Macromolecules. So since it has particles, then it leads to that property of having a good viscosity and elasticity. That's why it's able to do that lifting and projection in areas where you lack volume. So we're able to restore. How's it? How's the feeling? You feel some fullness?
Yes.
Yeah, that's normal. We're done with our filler. Now, on the upper third, I can do already the Botox injection. So when I do my botulinum toxin injection, I assess for the muscle movement, like muscle movement of the orbicularis oculi. Then I'll ask Juliet to smile for me, just like when you're being tickled by your partner. Okay. Yeah. We ask them to smile, and we can see some of the lines on the corners of the eyes, right? Sige, Juliet, smile for me. Like whenever you're so happy, you're in a pageant and full smile. So we can see some of the lines on the corner of the eye. So we call those crow's feet. So whenever I do it, so for Juliet, we wanted a treatment that is very like natural, that I want you to still have a facial expression. It's not really making your face immobilized or totally paralyzing the muscles there. You still have some of that movement so that people will know what is your emotion. So we don't want to create a frozen face, but we want a natural result that people can still know what you're feeling. Okay? Did you get my point?
Yeah.
Still with facial expressions, in short. Okay, so for the crow's feet, just a minimal dose there. I give only like, for example, the minimum dose of, for example, if I'm using a Botox or Xeomin, then I can start with 1 unit to 2 units for every injection point. Then let's proceed to the opposite side. So for Juliet, the good thing, I'm amazed. It's like you don't really have that much of lines. What's your secret?
Happy life.
Stay happy, no stress. Now,
Positivity.
exactly. So I'll work on the glabellar region. This is the procerus here. This one creates that transverse wrinkle, the line beneath that, or on the radix of the nose. And then I'll work on the corrugators. On the corrugators, this creates the so-called vertical wrinkle or the frown lines. Okay, so I'm just gonna inject small dose there, and then on the opposite side, small dose there. So this one we want to prevent the wrinkle, the frown wrinkle, or the vertical wrinkle there. Now I'll proceed with the forehead, and with the forehead we want to treat or relax the frontalis muscle. The frontalis is the one that is actually raising our eyebrows. So like if you look up, try to look up, then you can see lines there. Okay, so we want to target those lines, and we just wanted minimal dose, small dose only. Something that will give you a refreshed and relaxed look only. Right, Juliet? Okay. I'm trying to be very gentle for Juliet because we don't want as much as possible any bruise or any hematoma there because she has an event few weeks from now. Okay? And you know what? You have a title already. And that title is with you forever. It's etched in your name. A title we don't have, right? Okay, so we have done the part of the upper third of the face. Now for the mid face and the lower face, I'll just be doing like a fine tuning using my low molecular weight dermal filler or hyaluronic filler. So we want to also correct this line here, or we call it laugh line, this part here. So we see some of those indentations there. But for this part, if you work on the superficial layer, you just need a substance that's low molecular weight, plus it's able to spread itself in that superficial layer of the skin. Okay, so for this part, like I'll just direct my substance into that line there. So Juliet, you have a noticeable line here, right? It's already a deep line, a crease. So I need you to look at the opposite side. So turn to the right, your left. Turn to your left. And then I'm gonna like look at the crease there. So with my low molecular weight type of a filler, I can just direct it into that layer beneath, immediately beneath the line. So this one can fill it in and then push that line upwards. So it's just like filling in an indentation there or a depressed mark there. Okay, actually with this one you can see an instant result, and then immediately after we need to really massage it and to even it out. And I can notice some sunken marks too, right? Like in the past you may have acne, or the others say they had like a chicken pox, and then they notice they have this indentation in their skin. Then we can also correct that. So a little bit here, we can do a little bit of injection in that part just to improve the texture and make it even on the surface. Okay, so for treatments on the skin layer, you can make use of hyaluronic, low molecular weight, or even hyaluronic that's non-cross-linked to give that proper glow, or also improve the texture and give that radiance in your skin. Okay, so I can combine with my hyaluronic non-cross-linked to improve the texture of the skin and give proper hydration, prevent the dryness, and really give that softer and something like a radiant glowing skin, or even glass skin. Okay, so I noticed some pigmentation on this posterior aspect of the right cheek region, so we call melasma. Okay, and even on this side here, right? Like in our age, because we women, we have our estrogen hormones, it predisposes us in developing also melasma. Originally cloasma during pregnancy, and then after that it becomes melasma, and also sun exposure. We can make use of our like hyaluronic, non-cross-linked, and other skin boosters to improve also this one. Okay, so I'm still looking any other parts that have some deep lines. So far so good for the right side, and let's look at this part here. Yeah, there you go. A little bit here. and just a superficial injection. So I noticed some telangiectasias there, so we want to avoid that. Okay, there you go. And then a little bit here again. So we have done filler on the temple, Botox on the upper third of the face, and some low molecular weight dermal filler injections in some of the superficial wrinkles on the mid face and lower face. We'll show the result to Juliet when CSA Medical Aesthetics return. So we're back. We'll now show the result to Juliet. Juliet, here's our mirror. Okay. So we have done a combination, Botox injection, dermal filler injections, actually from the forehead to the mid-face and lower face. We did like temple filler and some of our baby Botox on the forehead, the glabella, the crow's feet, and also on the mid-face nasolabial line we did, and a little bit on marionette, and also the so-called laugh line there, or sometimes they call it parenthesis. Okay, so we did treat those parts, and right now, looking at Juliet, okay, I can see an instant result from the dermal filler injections.
Ganda ko.
Yes. You're already beautiful, Juliet. It's yung maintenance ng beauty ng face and making you look really younger, a lot younger, right? Because you're saying you're in your late 40s, but you look a lot younger. So any feedback, or you want to share your experience to our televiewers?
Thank you so much, Doc, for doing it so gently. I'm surprised. It's not so painful.
Yes.
And
We inserted the product materials. Okay, the filler will still improve over time. So this is just like the initial outcome, although you already see an improvement, especially on the temple, because it was really so sunken a while ago. I only use half cc here. Now on some of the lines on the sides here, as much as possible, I start with like a small amount, because we don't want to overcorrect it, because when you overcorrect, especially in a superficial layer, it might cause some of those bumps and lumps, and of course this will attract water. It might still gonna create that more volume there. So you can start with minimal amount of your dermal filler, then spread it in the dermis layer, and this will also give that improvement over time, because this will integrate and also spread evenly on the surface, on the upper layer of the dermis. Okay, congratulations in advance, and thank you for representing the Philippines.
thank you so much,
Okay,
Doc.
so we'll see you again. Do you have any like Instagram account that if they
Yes,
want to
you can
follow
me
you?
at Juliet Mirasol
And
at
see
Instagram
your
and
look.
Facebook.
Yes. Because some of our guests here, they want to see how are they like a week or 2 weeks later, or a month or a year later, and they just want to ask like, was it like effective, or was it painful, something like that.
Not so painful.
Yes, some people would really want to ask. Okay, and if you want to ask me questions too, okay, you may email us at csaskinclinic@yahoo.com, our Instagram CSA Medical Aesthetics, our FB CSA Medical Aesthetics. Our clinic is located here at the Infinity Shop, Pulong Maragul, Angeles City. Contact number 0933-860-9193 or 0917-504-4268. And we do hope that you still watch our other video episodes. You can find them at our YouTube channel, Contessa Salvador-Alapag. So thank you so much. God bless you all. When it comes to natural beauty, you can trust the CSA Medical Aesthetics.